Ready to learn about osteoporosis, bone health, and everything in between? That is exactly what we're going to cover. We're going to look at what osteoporosis is, a few of the different treatments you can get for it, some of the symptoms you might have, and we're just going to give you some tools and knowledge to hopefully give you some better knowledge on just how to deal with it. So let's jump right in, and if you haven't already subscribed to our channel, please subscribe to our channel for more videos helping individuals with all abilities navigate through the fitness, health, and gym industry. We'll go ahead and jump right in. First topic of the day, we're actually just going to introduce osteoporosis. So for those of you who don't know, what is osteoporosis? Let's talk about that. So osteoporosis sounds pretty scary, and to be quite frank, it really is. Osteoporosis in itself is just a term for a bone disease where basically the bone mineral density or the amount of minerals in the bones actually decrease from a wide variety of different things, and we'll kind of touch on a few of those further into the podcast. But when we're talking about bone mineral density, you're probably saying, my bones are made of minerals? Like, how does that work? So yes, actually, there's two very frequent ones that show up, being calcium and phosphorus. This makes up a large amount of your overall bone strength and the ability for it to just be nice and sturdy. So also something you'll find in osteoporosis when defining what it is that it'll be a decrease in bone mineral density, which we just talked about, but also a general decrease in bone mass. And bone mass and bone mineral density are essentially the same thing. Your bone mass is basically how heavy it is, and of course, if your bone mineral density goes down, as in the amount of minerals in it, of course, the mass is going to go down as well, because those minerals have a decent amount of mass, or it's not technically weight, but it's basically how heavy it is. So bones comprised of calcium and phosphorus, and as you'll see later in the treatment section, focusing on a couple of these things to kind of counteract that will help. One of the big things about osteoporosis is that it's very, very hard to detect, and it's kind of a silent killer is what they'll say. So if you are somebody who is at risk for osteoporosis, which we will later in the podcast kind of talk about who those individuals are that are high risk, you should be testing more frequently, and we'll kind of touch on that a little bit later. Just some CDC facts to give you about osteoporosis if you're not aware. Those who have hip fractures have an increased risk of death during the first 12 months after the fracture. So let's say, for example, somebody fractures their hip, and maybe they do or do not have osteoporosis, but usually the people who do fracture their hips do have osteoporosis. After that fracture, the chances of them dying 12 months after the fracture increase extremely greatly. So this just shows you how severe osteoporosis can get. It's not just the fact of having osteoporosis and the poor bone health. That's obviously not a good thing. It's what it can lead to. And this permanent disability is something that'll be a reoccurring theme, especially with older adults. You'll see this a lot in older adults, especially older women, and we'll kind of touch on that later. I have one example, actually. When I used to work at a senior living community, there was an individual who basically, she fractured, I believe it was her entire hip and some of her lower leg, so some of her lower body as well. And what happened to her, she used a walker up until that point. She could get around with a walker. After that, though, she literally had to use a wheelchair to get everywhere. And shortly after that, her health declined very, very rapidly, very, very quickly. So it's just one of those things where if you don't take care of it, don't keep up on those checkups, and something does happen where maybe you do have a fracture, it can lead to some very, very unfortunate complications as you go down the road. The really, really good thing that we will talk about later in this podcast is that it is very treatable. There are, of course, some genetic components to this where you might be a little more predisposed to developing osteoporosis just based off the cards you were dealt. However, just like most things with health and fitness, there are plenty of great things that you can actually do to help reduce the risk of developing osteoporosis as you age. So, speaking of osteoporosis as you age, something you probably want to know is who can get osteoporosis? Is this something that can affect everyone, right? So, basically, off the cusp, yes, anyone can get osteoporosis or anybody can develop osteoporosis, right? This is something that develops, it doesn't just happen overnight. But there are some populations who it is a little more common with. You may or may not be aware of this, but women, particularly postmenopausal women, at a higher risk of developing osteoporosis. And basically, a big part of this is that there are some hormonal changes, specifically estrogen, which affect bone health tremendously. After you go through menopause, your hormones, if they weren't already crazy enough, they get even crazier, and some of the bone health hormones like estrogen actually go down a little bit. So, with that happens, it doesn't only affect your mood, it affects your bone health as well, which is why a lot of women are normally dealing with this or notice with this, especially as they get older, postmenopausal. In addition to just women in general, non-Hispanic, white, and Asians are actually the most increased risk for developing osteoporosis. African American and Hispanic women are at less risk of developing osteoporosis when it comes to a both male and female perspective. But just realize that there is, again, some of that genetic variant that we talked about. So just because you're a woman, you might actually have an even more increased risk of developing osteoporosis if you are of Asian descent or non-Hispanic white descent. But again, these aren't anything we can really control or do about. It's just something to take note that you might be in one of those populations who would be advantageous to potentially get frequent treatment and to get those checkups much more. In addition to this, we talked about women, but this actually can affect men as well. Especially as someone gets older, you'll notice this theme that the older somebody gets, the higher their chances of getting osteoporosis are. Hormone regulation, specifically hormone regulation in a good way, actually decreases as we get older regardless. And when it comes to testosterone levels, those usually decrease quite a bit as we get older as well. This has a kind of less pronounced effect than the estrogen changes in females, but it is something to note that when males get older, their loss of testosterone will take a very, very tiny effect on overall bone health, and they are still at risk. One of the reasons why men actually don't develop osteoporosis quite as soon as women, females, is because they actually continue to develop their bone mineral density much later in life. So they're kind of offsetting that overall progression down the road, which is obviously a very big lever to pull when you're talking about why am I getting bone mineral density decreasing in my overall body. Again, males, that's just how it is. They develop it later in life. Peak bone mineral density, peak bone mineral density. What is this? It's basically the highest level of bone mineral density that you will develop in your life. This happens with a wide variety of things. There's like peak intellect in our life. There's peak muscle strength. Bone strength is the same thing. And our peak bone mineral density is usually around the 25 to 30 age range. So leading up to that in your childhood, this is actually a prime time for overall bone health development. So if you're watching this and you have either grandkids or even kids and you're like, what kind of sports should they do? They should be doing stuff that's going to be challenging their body. It's going to put load on bones. It's going to potentially even be high impact if they can handle that, because those different things help to improve overall bone strength. And when we're talking about different ways to prevent this going down the road, The bone strength and the bone mineral density you develop as a child can literally lead into the rest of your life. So it's a very, very important thing if you're a parent, if you're a caregiver of somebody who's a child, or even somebody who's still not quite into that 25 to 30 age range. There is still time. There's still time to develop your peak bone mineral density, because once you hit that point, you're basically kind of going back in time, right? So if somebody has a higher bone mineral density, or peak bone mineral density, I should say, you're giving them more years that their bones are going to be healthier and stronger. Just like somebody who is building a good base level amount of strength, the amount of strength drop off is going to be much less drastic over the years. So it goes the same with bones. Crucial time to develop, and you could still build this later. When I'm saying this, you're probably thinking, oh dear Lord, like if I wasn't physically active when I was a kid, like is all hope is lost? No, you can still develop bone mineral density and actually maintain it, and potentially even build it a little bit as you get older. But the peak is what we're talking about here. The peak is built through our early adolescence all the way up into about 25 to 30 age range. Something else that will kind of lead to potentially getting bone mineral density, if you're on any certain medications, and again, I don't know too much about the medication, this isn't entirely my scope of practice, but certain cancer medications and glucocorticoid steroids may increase the risk. This is because, again, their interaction with the hormones that happen in our body. And any medication that affects absorption of calcium and vitamin D, or just conflicts with that at all. There are a lot of medications that mess with a lot of different things. They fix one thing and then lead to another thing. And this is the same when it comes to those types of things with vitamin D and calcium. And those two are crucial. We'll talk about those later on different ways we can kind of prevent it. Also, there's something I actually just learned about this. It's called idiopathic juvenile osteoporosis, where basically as a juvenile you develop it just because, again, the cards you were dealt. It's something genetic. It's sort of rare. It's not really seen very often in common society. I actually just learned about it, as I said. Most recover with absolutely no treatment, as in they don't really do much about it. After they get tested, they just kind of go around their normal lives, try to, I'm assuming, become physically active and eat well, and it just kind of works out on its own. So that is talking about who can get osteoporosis. Anyone can, but certain demographics, specifically females, older females in that non-Hispanic, white, and Asian descent, are going to be at the highest risk. So remember that if you do fall into that category. And if you're finding value from this video so far, please consider liking it. I greatly appreciate it, and it helps to spread this knowledge to individuals of all abilities to get it out there. Okay, so next portion, let's move right in. Symptoms of osteoporosis. You know, maybe what are some ways you can tell if you have osteoporosis? And this is the really tough part about osteoporosis, is because, as we mentioned when we were kind of introducing osteoporosis and talking about it, we described it as a silent killer, as in you don't really know you have it until you potentially fracture a bone, lead to that permanent disability that comes from it. So with that said, there's actually typically no symptoms. There are a few, but they're kind of more correlation, and they could or could not be related to actually developing that osteoporosis, but typically no symptoms. One of the things that we'll talk about is potentially a decline in posture. So if you notice somebody, maybe they're really, straight and sturdy with their posture, and over time they start slouching, it could be due to osteoporosis, the bones weakening and your body not being able to support you that much. This is where it kind of becomes a catch-22, because they're like, okay, there are just some age-related changes that happen with individuals as they get older, where their bones might just deform that way. Naturally, they still might have perfectly healthy bones, but that change might have just happened. In addition to this, you might have different pain in bones, or specifically areas that you don't normally notice pain. There might be some tiny microfractures that occur without you even noticing it. And this goes back to the understanding why screening is so important. And if you are in one of those high risk categories and you're like, I don't know if I have osteoporosis, it's something that's good to check. It's something that's good to check. And the sooner you can check it, the sooner you can treat it and kind of deal with it. So screening is important for those different risk categories. And we'll actually talk about a few more risk categories in the next section of this podcast. But some other symptoms of osteoporosis: you might have bone breaks during very minor activities of daily life. This is probably one of the most glaring symptoms. And unfortunately, when I say symptom, usually you want it to be something that's not overly dangerous or detrimental to your health or well-being before you can actually get to it. Say, for example, somebody has a cough, and this is before they get a full-blown flu. You could likely do something, take some cough medicine, get some extra sleep, eat some health promoting foods with lots of vitamins and minerals to kind of offset developing that flu. When it comes to osteoporosis, the bone break being the symptom you can't really do much at that point. Obviously, you're going to recover, and once you recover and hopefully the bone heals, you're going to get back to improving your bone mineral density after that. But it's something you can't really track until it happens. Again, why screening is so crucial. Some of these minor activities I'm talking about, and this is actually something that happens. You might sit down too quickly in a seat. You might kneel down too fast on the ground and your knee hits the ground. You might bend over to pick up a box. You might just lift up something small, a couple plates, moving some different things around your house. You might even just cough. These are all different minor activities that if you have osteoporosis, and specifically very severe osteoporosis, you might actually break your bones. And it sounds crazy when you're listening to it, but this happens all the time. So again, screening is so important because these things can literally happen and you don't even know it. It is a silent killer, osteoporosis, for sure. Okay, so now that we're finished with that, we can go into the next portion. And we kind of did touch on this already, but we're going to look at causes and risk factors of osteoporosis. And this is going to be a kind of multifaceted approach. As we mentioned when introducing this, there are some things that are completely genetic when it comes to osteoporosis that you can't control at all. But there's also plenty of things, as in risk factors, that are highly changeable. You can do something about it, which should make you very excited if you are at risk for this, or potentially if you already have it. So before we get into risk factors, I wanted to introduce an anatomy term called, osteoblast and an osteoclast. And understanding these two cells in your body will help you to kind of realize some of the risk factors and dynamics that are going on. So osteoclasts are a cell in your body that actually help to break down bones. It helps with what's called bone reabsorption. Osteoblasts help to build bones. And the way I remember this is blast build. So osteoblast builds bone structures and it helps to build bone mineral density. Osteoclasts break down bone mineral density, break down your bones, and actually they can use some of that calcium and different things that are stored in the bones for your body in times of distress. Obviously, this is going to hopefully be at an equilibrium. You really don't want your bones to just be breaking down. You don't want those osteoclasts to just be breaking down constantly, which is why focusing on these lifestyle and risk factor things are so important. But just understand that osteoporosis is largely a dysregulation between these cells, so there's going to be more osteoclast work, as in breaking down of the cells, versus osteoblasts or building the cells. So one of the first things that is you can't change is actually your sex, or if you're male or female. So as we talked about earlier, females are at a much higher risk for developing bone mineral density lacking in their life. Women have lower peak bone mineral density, which is one thing. So the absolute amount of hardness or stiffness from their bones is actually not as high as males, as we talked about earlier. And they also have smaller bones in general. So these kind of go in tandem to why they're at a greater risk. Men still have a risk as they age, should be foretold. Men have still have a risk, especially as you get older and older and older. And with all this gene sequencing stuff that's going on, the advances in technology and medicine, the amount of people that are actually going to be living to those longer lives is going to be even more important. So even if you're a man, still paying attention to your bone mineral density, and as you get increasingly older, checking on it, making sure it's good, should be a priority for you. Another thing that we can't change is age. So bone loss happens more quickly as you get older. Again, this is from that dysregulation between the osteoblast and osteoclast. Osteoblast builds the bones, clast takes it down. There's more osteoclast work, and there's also some other hormonal changes. We talked about estrogen and testosterone kind of helping with the creation of bone. So those go down a little bit as you age. Again, something you can't change. In addition to this, also new bone growth is slower. One of the great things about becoming older is that not only it's tougher to maintain something, but also building new tissue, specifically in this case bone tissue, is also slower. Next portion of this, body size. Body size. How does body size affect your chances of getting osteoporosis, your risk factors? So this may be kind of a surprise to people, but being too skinny can actually have some health concerns, and osteoporosis is a common theme, common time when this happens. So if somebody is too skinny, they're actually at a higher risk for developing osteoporosis for a couple different things. One, they actually have less bone to lose. So usually individuals who are skinnier, they're gonna have smaller bones in general. Again, we're talking about usually elderly females when this happens. Their bones are gonna be very small, as in they don't have that much to lose in times of breaking a bone or famine or not eating that much. So they have less bone to lose. In addition to this, they're probably not taking a substantial amount of calories and protein and calcium, vitamin D, all these things we know that actually help to keep your bones healthy. They're at, essentially, they're probably not taking those in as much, right? So when they don't do this, the chances of them fracturing a bone, developing osteoporosis, and then fracturing a bone goes up exponentially. So body size is a huge case, and this isn't me going to say, yeah, go out, gain a bunch of weight, because there's complete health complications on the other end of that from becoming obese. We just did a podcast recently on obesity and weight gain and all the dangers with that. So this is maybe on the opposite spectrum of being too underweight. You don't want to be too skinny. Finding that healthy weight range is crucial for all of this. The next portion of this as a risk factor is race. So as we mentioned earlier, white and Asian, specifically women, are at a higher risk. But if you're a white or Asian male, you are at a higher risk still than your Hispanic and African American counterparts. So whether you are male or female, females are going to have that higher risk we just talked about when it comes to race. White and Asians are at an increased risk, and African American and Mexican Americans are at a lower risk for developing osteoporosis specifically. Remember, this is one specific case. There's other things like obesity is one of the things that tends to be in kind of those ethnic backgrounds. It's a little bit higher. Osteoporosis is a little bit different. Very good. Okay, so the last thing when we talk about risk factors is actually the history. So if you have familial history of developing osteoporosis, again, talk about genetics. Thanks, mom. Thanks, dad, for giving me the osteoporosis gene. You're at an increased risk if you have family that have already had it And this is kind of the same thing as heart attacks, developing diabetes. This is something that is very frequent in a lot of this anatomy and the body. So again, if you are liking the video, please like the video. I appreciate you checking this out, and if it's given you any value, I'd greatly appreciate it as well. So, okay, so we're gonna keep moving on. So more risk factors, more different changes, and this next thing we kind of addressed earlier was actually the changes in your hormones. So low estrogen in women is one big thing, especially after menopause. This happens pretty greatly. In addition to this, low estrogen from absence of menstruation. It could be from premenopausal women, right? Well, of course, if you're still menstruating, you're premenopausal. So that was kind of redundant, apologies. But if you are somebody who's hasn't gone through menopause yet, and you have a loss of estrogen, this is usually because you're too skinny, too small, and many times these are like professional or very high level athletes who are also being very, very active as well. So they're holding a low body weight, they're extremely active, they are probably not eating enough food to maintain their overall body weight very well, obviously, but also maintain those hormonal regulations as well. So the low estrogen can actually be from that extreme activity, being at a too low body weight, even before you get to menopause. And of course, if this is already an issue before menopause, just imagine what the issue would be once you get to menopause and the estrogen goes down even further. So if you're already noticing some dysregulation in your period, this could be a concern. I'm not going to say that it's a red flag, but it is something to be considerate about when you're talking about your bone health, especially if you're a woman. So low testosterone in men can also lead to this when we're talking about hormonal changes. This isn't, again, kind of a huge driver, but it is something to consider as one of those varying hormonal changes. Likely not a huge cause, though, as we talked about earlier. So some of these next things are going to be hopefully a little more stuff you can do. So diet's one of the biggest levers, and we're going to talk a little bit more about different treatments when it comes to your diet and what you can do. But excessive dieting, as we just discussed, if you're not eating enough calories to maintain your weight and be at a healthy weight, and not only calories, get enough protein that helps with bone growth and formation of all your cells, that's going to increase the chances of getting osteoporosis. Poor protein intake, we just mentioned that. Diet's low in calcium and vitamin D. So this is be a good time for me to explain actually what calcium and vitamin D do. Calcium, as we discussed in the section of what is osteoporosis, actually helps to build up the overall bone mineral density or bone strength in your bones. So it's one of the things that actually keeps your bones strong. So of course, to not develop osteoporosis, you need to be eating that through your diet. Otherwise, your body can't synthesize it. It can't just make it up. So it needs to be taking it in, breaking it down, and building it on your bones. Vitamin D. How does vitamin D play a role into this? You always see people thinking about vitamin D and calcium together. Well, vitamin D actually helps with the absorption of this, absorption of calcium, I should say. So if you're getting enough vitamin D and calcium, you're going to be good to go. But having too much calcium and not enough vitamin D, it's not going to be able to be absorbed properly. So making sure you're getting both of those is substantial. Vitamin D, yep, perfect. So some more risk factors. Unfortunately, if you've ever dealt with any cancers, usually individuals who have had cancer of any sort become very, very low body weight because of the nausea from the chemotherapy and all the treatments. They usually don't feel like eating, so they can become severely underweight very quickly from that. And as we discussed, individuals who are very underweight are predisposed to a higher chance of osteoporosis because they're losing a lot of potential just bone mass from losing weight in general, but they're also not eating enough to regrow and rebuild it too. Anorexia nervosa, this is being excessively skinny. We've addressed this again numerous times. The skinnier you are, the higher chance Gastrointestinal disease, this is something that I actually didn't consider, but it's a good point to note. If you have any type of GI disease where it's a little bit tougher for you to actually take in, not just take in food, because you can eat food, but digest and break down that food and use it properly throughout the body, that's going to increase your chances of osteoporosis, of course, because if you eat that food, but it doesn't process and doesn't go well through your body, through your disease, that calcium is going to do nothing. All those calories and all that protein and all that, those different things that help to build your bones, it's going to do nothing. So gastrointestinal diseases basically leads to issues with your absorption of food. Hormonal diseases. I don't know all the different hormonal diseases, but as we've discussed numerous times already through this podcast, hormones are incredibly crucial in maintaining them properly. So if you have any hormonal disease, especially if you get older, this is something to take note. You're at a higher risk of developing osteoporosis. So next portion, medications. We kind of talked about this earlier. So long-term use of glucocorticoids. These are things that are often used to treat asthma and arthritis. So if you are a kid when you're older and you're taking a lot of inhalers and different things, this could increase the chances of developing osteoporosis just because of those glucocorticoids. These are also used with individuals who have arthritis. So if you are a senior and you are currently taking something like this, just realize it may help some of your pain and stiffness immediately, but long term, it could have some complications on your bone health. Individuals who are taking anti-epileptic medication. So epilepsy is basically a different type of seizure. So if you're taking something to offset this, it can actually cause some issues with your ability to build bones. And cancer medications, we talked about cancer earlier, as you might be actually too skinny, getting too skinny from not eating enough food, but there also can be some conflicts in the medication you're taking from the cancer, which can mess with the hormones in your body, specifically hormones that are going to affect bone health as well. Last but not least, of course, lifestyle. This is a huge lever to pull when we're talking about things to actually make your bone health last and much better for yourself. Lifestyle. So low levels of physical activity, one of the biggest things, right? Older adults, and this is something that I've seen very frequently with a lot of individuals that I work with. Older adults are afraid to move. They're afraid to actually make it worse, especially if they know they have osteoporosis. They're afraid to move, they're afraid to slip and fall, and because of this, they just maybe don't do anything at all. And it seems like a good idea at the time, but then you realize that those activities and those weight-bearing things are actually going to lead you to building more bone mineral density, more bone mass, and getting better. Doing stuff like this leads to less stress on the bones, which literally will lead to osteoporosis if there's not stress and there's not a reason for those osteoblasts, right? We talked about osteoblasts earlier, those help build to bones. If we don't use those or don't give our body a reason to use them and activate them, guess what? All that bone is going to do nothing. Those osteoclasts are going to come in, break down that bone. Poor shape in general. So if you are somebody who is not just moving around throughout the day, and a lot of these examples are with elderly individuals. So if there's an elderly individual who's basically just kind of in poor shape from not moving that much, they're actually going to be at an increased risk for falling and fracturing themselves, on top of the fact that they probably aren't bearing too much weight on their bones in general. So it's kind of a double-edged sword. The being in poor shape, not being physically active will not only decrease their bone mineral density, it will increase the chances that they're going to fall because they're not used to doing all these complex activities outside of the day. Poor diet. We'll talk about poor diet in a second when it comes to treatments. We kind of touched on that earlier, but also smoking too. If you smoke, you're at an increased risk of developing osteoporosis. This is still kind of, I wouldn't say is up in the air on if it's a concern. It is a concern, but kind of the mechanism behind it is still getting work. So if you made it so far in the video, please consider subscribing to our channel. We make videos on helping individuals of all abilities navigate issues with health, the gym, fitness industry. So thank you so much for watching so far. And we'll keep moving into the next portion of this, which is, of course, now that we know some of the risk factors, we can talk a little bit more in depth about who should actually get tested for osteoporosis, right? It probably makes sense, like with most health things, that not everybody needs to get tested. So who should get tested? And if you've watched most of this podcast so far, you're probably getting a good idea of if you should get tested. Any woman over 65 years old, it's probably a good idea to get tested as you're getting into that senior category, that elderly category, becoming an older adult. The chances of you developing it goes up tremendously, specifically if you're a woman. Also, any woman who is at an increased risk. We talked about women earlier who are at a very low body weight, not physically active, or are simply too active, so they might be doing too much where maybe they lost their period. Again, we talked with the period, messing with the hormones in your body that help with bone health, so some things you need to be considered. Also, another high-risk category, individuals who are on a large amount of medications that I'm saying promote osteoporosis. Of course, we don't want anything to promote osteoporosis, but if it does conflict with the absorption of different nutrients, it leads to less body weight, it leads to hormonal issues. Of course, those things are going to increase your chances of getting osteoporosis, which if you are, again, we're talking about now people who should get tested for osteoporosis, this would probably be a good category. Younger women and older men should consult with their physician, and actually all these categories should consult with their physician. This is just kind of my general knowledge of what I've learned so far. The higher the risk, the more often you should get tested, and the potentially more serious of treatments or focused of different things you should do to actually help to decrease the chances of getting osteoporosis for yourself. So who should get tested? At some point, probably everyone should, but if you're at those really high risk categories, it'd be a great idea. And just go talk to your physician just in general. Maybe you're not even concerned about it, but you are concerned at one point about it. Most of us, thank God for modern medicine, are going to live to potentially 80, 90, 100, no problem nowadays. So with that said, though, just because we're living longer, it doesn't mean our quality of life is going to be better, and things like osteoporosis can actually come from that. So just be mindful of this, and if it is something that is concerning for you, and if you fall into those categories, make it a priority for yourself. And if you're finding value from this video, please consider liking it and sharing this with others. So the next portion of who should get tested, so we talked about who should get tested, but what do they do when it comes to a test, right? So, you know, when it comes to bone mineral density, it's like, how do you test it? You know, my bone's in here, like, it feels hard, right? Is it a strong bone? So what they actually do is this thing called a DEXA test. It's basically a bone scan test, and DEXA, or dual energy X-ray absorptiometry, is essentially a low-grade X-ray that goes over your whole body, and it can actually tell how thick or how dense or how much bone mineral density your body has. And this is actually a really cool thing that is used for individuals who are getting their body fat tested as well. It scans your whole body, and you can see different areas that have fat mass. In maybe your right leg is more fat than your left leg, and you have more muscle in your left arm than your right arm. It's a really cool thing, and it actually does the same thing for your bones too. So it scans your body, and what it does is it gives you a T-score, and a T-score is essentially a comparison of what your bone is compared to healthy bone of individuals that are, as we talked about earlier, in that peak bone mineral density range of about 25 to 30. You're comparing the healthy your bones with a T-score to bones of that healthy, you know, early adult area. So the scores are based on healthy bones. So when it comes to your T-score, it will come in basically a number from You know, it can be very wide, but I've seen some that are like -4. I've seen some that are 4. Basically, a +1 to a -1 is what is considered a normal or healthy bone. So if you come back from your DEXA scan and your T-score is +1 to -1, you're good, right? If it's, let's say 0.5, you're good. If it's 0, you're good. Just know it's that different range, right? Individuals, and also I should say the higher it is, the better too. So once you get to -1, that's kind of the lowest barrier you want. After that, -1 to -2.4 is considered an osteopenic bone, which we'll talk a little bit about the difference between osteopenia and osteoporosis in a second. And then -2.5 and lower is a osteoporotic bone, or a bone that has developed osteoporosis. And one of the really cool tools that they have out there is called an FRAX tool. And this is a fracture risk assessment tool. Basically, it can use a 10-year likelihood of minimal trauma fracture. So you take this little assessment and it'll give you a 10-look outlook on how likely are you to fracture yourself. And I haven't actually looked at this test because it's only available to providers, and I don't really do stuff like these with individuals. But I would guess the test or the different screening would have something like, what is your current physical activity level? Do you do high impact activity? Do you smoke? Do you eat a diet high in calcium or vitamin D? Do you get enough sunlight? All these different things that can help with bone health. It's probably screening those things and can give you a 10-year outlook, which is really cool because guess what? If you do take this assessment, you won't have to use a DEXA scan. So as we mentioned earlier in the podcast, if you're somebody who's maybe still interested on, you know, am I at a higher risk for developing it in the future? This would be a good assessment tool for yourself. So if you're maybe a premenopausal woman, or even if you're postmenopausal but still feel like you're active and okay, this could be a really good thing for you to test. So that kind of describes that. And we talked about osteopenia earlier, so I wanted to introduce and kind of just do a little section on the difference between osteoporosis and osteopenia, because I didn't fully know this too, and I think it's good to know the difference because one can lead to the other. So as we just discussed, a +1 to a -1 when it comes to a T-score is a healthy bone. -1 to -2.4 is an osteopenic bone. What does osteopenia mean? Osteopenia basically means it's a category. It doesn't mean anything particularly, but it's just the category of bone health based off the T-score before osteoporosis. So if you are somebody with osteopenia, you are at an increased risk of developing osteoporosis. This should be a concern if you have other risk factors: smoking, poor diet, low physical inactivity, and basically, if you're still confused on the difference between osteopenia and osteoporosis, I kind of like using the overweight and obese example. Being overweight is one classification of different healthiness of weight. So there's healthy weight, there's being overweight, and there's obese. Obesity is something we should all try to avoid for all the health complications from that. Being overweight, you don't have nearly the health complications of being obese, but you are at an increased risk of becoming obese sometime. Osteopenia is the exact same thing. If you have osteopenia, if you don't do anything about it and don't try to improve your bone mineral density and your T-score, the chances of you getting osteoporosis and developing that actual full-blown bone disease is going to be much, much higher. If you are somebody -2.5 and lower on your overall T-score, this is something that needs to be treated immediately, and hopefully you get to a point where you're actually being proactive and can make some changes in your life so you don't have to have a fracture and potentially lead to those other bad things. So probably one of the things and portions of this that a lot of you guys have been waiting for and want to know, how do we prevent/treat osteoporosis? And the good thing is, as we mentioned earlier in the podcast, is there are so many different things that you can do to actually decrease the chances and basically improve the likelihood that you won't get it. So we're talking about controllable items. Earlier in the podcast, we talked about genetic and all these different components that you can't really do anything about. Some of these hormonal changes are just part of age, right? When you get older, you're at an increased risk. So these next portions are controllable items, and they have a huge, profound difference on the chances of you developing osteoporosis. So make sure you pay attention. Okay, the first thing is diet. So this is something that's like shocker, having a healthy diet, high in fruits and vegetables, decent in overall calories, high in all these vitamins and minerals we know are good for us, is going to decrease the chances of us getting osteoporosis. Fruits and veggies have a bunch of different things in them, like minerals and nutrients, which help to offset osteoporosis. Something else, though, as I mentioned too, osteoporosis is usually a disease of not having enough calories, as in you can't have your body can't hold itself as when it comes to body weight, right? So if you don't eat enough calories, you're going to be very, very underweight. And usually individuals who have osteoporosis aren't eating enough food. They're very underweight. Their bones are now taking the minerals and potentially a little bit of that protein to use it in the rest of the body functions, and that's not a good thing. So making sure you're getting substantial calories. I don't want you to overeat and become overweight, as we discussed. That's not, but getting the proper amount of calories for yourself is key. Foods that are high in calcium. Calcium is one of those often talked about nutrients. Specifically, it's a mineral that your body needs, and it comes in different forms. Some of them are dairy, cheese, yogurt, sour beans, leafy greens, and almonds. So those last two are kind of some ideas if you're vegetarian or vegan, how you can get some calcium in your diet. I actually thought it was pretty neat that leafy greens had a decent amount of calcium in them, because you often hear people drink, oh, get your glass of milk for calcium, and that's true. It'll get a decent portion of calcium for the day, but you can also eat some, spinach, leafy greens, these things too. Stuff that's high in vitamin D when it comes to your diet will help to reduce the chances of osteoporosis. Vitamin D from the sun. This is something I haven't talked about a lot, actually at all yet in this podcast, I don't believe, but you can actually get vitamin D from the sun. And what happens is when you get sunlight, your skin actually takes in provitamin D from the UVB rays. And what happens in your body is that vitamin D can be converted to pre-vitamin D, which is the vitamin D we use to help with the absorption of calcium. During the summertime, pretty much anyone gets enough of it if you go outside for even 10 to 15 minutes of the day. During the winter time, if you are, I can't remember the exact coordinate, but basically if you are in the Western Hemisphere, in the northern section, so above the equator, during the winter time, the sun isn't as intense, sun isn't out quite as long, so you won't be able to get quite as much vitamin D, or actually the necessary values of vitamin D from sunlight. So you need to be making sure you are eating it through your diet. Your doctor may recommend a supplement. I would talk to them about that when you're going and getting your osteoporosis tests and treatments, and just kind of discussing your options. If you are at that high-risk category, a doctor may recommend a supplement for you. Otherwise, you can get it through fish, eggs, yolks, liver, and fortified foods. One thing you'll often see is orange juice has vitamin D fortified to it. And this is just a way to potentially get you to increase your overall vitamin D consumption. There's also a lot of cereals that have it too. And the last thing that's usually lacking in people with osteoporosis is protein. So making sure you're getting stuff high in protein. For you who do eat meat, chicken, beef, fish, eggs, and dairy, that would be a vegetarian source. Otherwise, when it comes to other ways you can get in protein through veggie sources, there's whole grains, beans, tofu. This would be a little bit tougher for you to get those protein sources in. So if you are vegan or vegetarian, make sure, I would actually recommend to get a supplement. So like maybe a pea protein supplement or some type of supplemental powder that's vegan for yourself, because it's usually very hard to get protein. And also it's very hard to usually get calories in some of these vegan and vegetarian diets, specifically vegan diets if you're following very, very strict vegan diets. So just something to consider. You might need a supplement. And again, if you are enjoying this video, if you're finding value from it, please consider liking. I greatly appreciate it. And the next part is lifestyle intervention. So that was kind of diet. Now we're moving into lifestyle. So one of the biggest things is smoking related. As we talked about earlier, kind of the mechanism with smoking isn't fully sussed out, but we do know that if you do smoke or even are exposed to secondhand smoke, this can actually increase the chances of getting osteoporosis. And thankfully nowadays in the 21st century, smoking is kind of something of the past. It's not really getting talked about or even done nearly as much. Vaping is kind of the new thing, which is kind of a whole catch-22 of all their potential issues, but smoking's going way down, so hopefully this isn't as much of a spread or message to others, but smoking, bring that down. Alcohol, drink moderately. If you are a female, that means 1 drink per day is considered moderate. Males, 2 drinks per day. I personally think if you can cut alcohol out of your diet completely, that'd be a great idea, because alcohol is not something you need. And if you can manage your stress, if you can reduce your anxiety and do all these things without the use of alcohol, the potential dangers from alcohol if you start drinking are exponentially high. And maybe a social setting, it's sort of good, but I can't find any reason that somebody would need to drink alcohol, right? Like, there's nothing that really benefits you inherently. If you want to, that's okay. Feel free to, but a lot of the data with brain health, especially nowadays, is not good when it comes to alcohol. Another big lifestyle thing, and this comes to your health in general, is getting frequent checkups. So if you are somebody who is high risk for developing osteoporosis, I'd highly recommend getting frequent checkups, in addition to your other blood work stuff. So, potentially elderly individuals are probably going to get different blood work tests. Maybe if you are somebody who just stumbling on words, just got done with having cancer treatment, you're at a higher risk. So I would recommend maybe getting checkups specifically osteoporosis related. If you are a female in that high risk category, if you are somebody who's very underweight, knowing your risk category and it is something you should really concern about makes this key. If you are high risk, getting those frequent checkups. And also you can ask them about anything that will affect your bone health. In addition to this, I've hopefully given you quite a few good ideas and some knowledge, but at the end of the day, I'm not everyone, and everyone's got a different perspective on this, especially doctors. So get second opinions, get some more advice as well. The next portion of this is exercise, and exercise is probably, in addition to nutrition and diet, is one of the biggest levers you can pull to actually decrease the chances of you developing osteoporosis. And when it comes to exercise, your early childhood and adulthood, is one of the best times for you to develop bone mineral density. And we talked about this earlier, that peak bone mineral density between 25 and 30 years old, roughly, is when we can literally build so much of it. So we honestly have a little bit of extra reserve as we go down in age, as we get older, of course. Consistent activity is the key. So running and jumping, specifically high impact activities where you're placing lots of load very quickly, very rapidly on the ground, is going to improve your bone mineral density. It's going to tell those osteoblasts to help build bone. With that said, if you have osteoporosis, it's probably not a good idea to do high impact activities because you're at a greater risk for a fracture. So doing high impact activities, assuming it's not painful and it doesn't hurt you, is a great way to hopefully stave off that osteoporosis. But if you have osteoporosis, probably good to do some of these other activities such as resistance training. Resistance training is one of the biggest levers you can pull, and this could be something like free weights, it could be exercise classes, it could be low impact exercise classes. It doesn't matter, just putting stress and weight on your bone, anything that is weight bearing and puts a little bit of extra load on your bone is going to essentially build your bones. So don't overthink it. Anything is good. Even just picking up objects around the house, doing wheelbarrowing, with different gardening activities outside, moving stuff outside. All these things are putting stress and demands on your body, which get you stronger. Speaking about getting stronger, a good proxy you can use of, if your bone health is good is how strong your body is. If you have a strong body, your bones or the muscles, your body is literally connected to the bone. So you can't really have for the most part, a strong muscle without a strong bone. So just know that if you're working your muscles through stuff like resistance training, your bones are going to actually be improved in strength as well. I've mentioned resistance training like 5 times in the last minute. Just know it's important. But even stuff beyond that, walking is a great activity. It is much lower impact than per se running or jumping, but walking still does place some direct contact on the bones, gives it a little bit of activity, and it's weight bearing. That's one of the big keys. And beyond osteoporosis, all these different things with exercise, I just feel like I have to mention as a health professional, your heart health improves, muscular health, joints, brain, blood sugar regulation. All these things will holistically help us to be healthier is so crucial. If you want one pill or one medicine you can do the rest of your life that will basically get rid of 80 to 90% of the diseases, exercise frequently. So crucial. Find something you enjoy. It doesn't have to be crazy. The last thing of how you can treat osteoporosis, and this isn't within my realm of practice, so I'm just going to touch it, is medication. There are some medications that you can use that your doctor may prescribe you that could actually help to increase the chances of your bones getting stronger and decrease osteoporosis from having. And this is kind of like vitamin D supplementation too. Just something you consider and should talk to your doctor about. So after that, kind of a secondary thing, we're going to talk about fall prevention when it comes to osteoporosis. So if you are somebody who is at a higher risk for developing osteoporosis, specifically those older adults, and we know that when you do fall, if you do have osteoporosis, the chances of it being potentially damaging for the rest of your life is incredibly high. I wanted to also tag in some fall prevention stuff as well. As we just mentioned, breaking a bone can be extremely devastating on your health, can affect your quality of life, lead to permanent disability, and your body may never be the same. That individual I talked about at the beginning of the podcast, they were never the same. They never got back to that level that they once were. So it's very, very unfortunate and just sad, but it's something that we can hopefully prevent falls and kind of tweak a little bit if we do have osteoporosis. So one of the big things you can consider if you do have osteoporosis and you want to prevent falls is kind of checking your ego to the side. And if you do need an assistive device like a cane or a walker, be okay with using that, because you may realize that, okay, I need this, at least right now, right? I need this right now. If I don't use it, I might fall and hurt myself. So using those assistive devices when you need, using railings when you're walking up places, maybe when you're getting in and out of a tub, you might need one of those special ones to get in and out. Use railings and assistive devices when needed. Limit non-tripping hazards around your home. That's also crucial. So if you're thinking about your home, is it set up in a way that would increase the chances of a fall? As in, is there clutter on the ground? Are there different rugs and different things that you might fall over and trip over? This is something I just thought of, but maybe you have a dog or a bunch of animals. Maybe you have a grandkid that comes over and there's toys everywhere. Those are all risk factors that could lead to actually falls. So just being a little more intentional with our thoughts of how we set up our home can lead to a lot less risk of breaking a bone from that fall if we do have osteoporosis. Another thing is to wear non-slick shoes. Certain flooring also I would be aware of. So, stuff that's kind of like linoleum, different floors, even really glossy hardwood floors can be very, very slick, especially if you're wearing socks or something. So make sure you have proper shoes on, or just go barefoot if you can tolerate that. In the bathroom where it's wet, obviously that's a huge fall risk. So just being extra careful around those areas. One of the things I always talk about when it comes to reducing falls in elderly is actually to give yourself extra time when planning and going from different activities, right? So we often try to plan a certain amount of time per day, like, oh, it takes me an hour to get from the grocery store to the post office and do X, Y, Z. But the thing is, if you're at an increased risk of falling because you can't move as well, you can't move as quickly in your life anymore, guess what? You might start rushing things. You might start stumbling over things because you're trying to get things done because you didn't give yourself enough time. So just give yourself extra time, give yourself a little bit of extra cushion. It can go a long way in decreasing your stress of needing to get all these things done super, super quickly. Keeping physically active, as we just discussed in the previous discussion on treatments. Balance and strength is crucial, and the only way to improve your balance and strength is by continually strengthening your body through resistance training, difficult activities, challenging your balance. All these different things we know can help us, but we just need to be a little more intentional and try to incorporate those routines into our life. And this isn't to go to say, you know, oh, Logan, you just said if I have a cane or walker, I should be using that to walk around. Yes, for the most part, yes, you should use those assistive devices. But at the same time, you also need to try to be pushing your boundaries a little bit more. You need to try to be improving your overall independence without those things. So under a controlled setting, maybe you have an exercise professional with you, maybe you have a physical therapist trying to work with you of walking without using a cane. That's also crucial too. Know your limits, ask for help when needed. This is kind of tough, but sometimes we just need to check how you go out the door. If you're struggling getting up from somewhere and you feel like you're at an increased risk of falling, ask for help, ask for assistance. There's always somebody who's willing to help you. And also stairs and walkways, use railings when possible. Try your best if you can't get upstairs too well to maybe see if there is kind of one of those sloped walkways. But at the same time, if you're capable of getting up those stairs, by all means do it. If it's a little challenging, but that gives you a little bit of work with your muscles, please do it just in a safe manner. And lastly, just a quick summary of some of the points. Osteoporosis is mainly found in older individuals, specifically women of the, white Caucasian female background, in addition to Asians, so kind of the Caucasian females. In addition to that, if you are just older in general, you're at an increased risk of developing osteoporosis. It can be greatly treated and reduced with resistance training and eating very properly. Specifically, we need that weight-bearing activity though. So making sure you're also at an appropriate body weight throughout your entire life. So maintaining that healthy body weight is crucial. And if you are considered high risk, checkups are greatly recommended. I can't say that enough. So please, if you did like this video, subscribe to our channel for more videos helping individuals of all abilities with issues like osteoporosis and keeping you fit and healthy in life. Thanks again for watching. Please consider liking the video as well. And I'm going to link another video in the pinned comment of this section on different ways you can actually work through bone treatments for osteoporosis as well. So thank you again for watching, and we will